It's a great opportunity for us to give back to the community that supported us for several decades. We've been around since the early 90s and taking care of patients all throughout the community, not only Fort Collins, but surrounding communities as well. And a lot of healthcare providers, nurses and doctors like to go overseas to do medical mission trips, and this is an opportunity to do it right here in our backyard. There's just as much of a need here as there is in many of the places that we often go to when we want to do medical mission work. So it just offers a great opportunity for people to give back to the community and volunteer and save some lives. Because we all know that colon cancer is the second biggest cancer killer in this country. And it's the #1 most preventable cause of cancer death. Colonoscopies save lives because you find cancers that people otherwise don't know they have. And getting them early is the key to survival. Well, it's always a stretch for any facility because even though we're not, the people that are working here today are all volunteers and not getting paid big amounts of money, it still costs money to provide these services. So we've been lucky to get some donations of equipment from some of our vendors, and we found enough people to volunteer that we could put this together. But it's always a stretch to do it, just because the system's not set up for that sort of thing. But it's definitely worth it. It's worth going through the hoops to get something like this rolling, and we'd be excited if other facilities in the area started doing something similar. Our nurses have been working hard and putting in a lot of hours, and let's face it, we can't compensate people as well as they probably should be compensated. So it's a sacrifice for our staff for any staff to come in and do extra work like that, but it's well worth it. It feels good to do it, and you feel like you're really doing some good for people, which is why we all went into this career to begin with. I think there's a need, obviously. There are a lot of people who are not quite poor enough to qualify for Medicaid. They're what we call the working poor, that are just barely making ends meet, but they're not making a low enough wage that they can get government assistance. And so there's a pretty large section of our population that fits that, and so there's definitely a need. We see it. People are coming forward to getting in line for these procedures, and so yeah, if we could make it a regular thing or even have it rotate among facilities, that would be my dream. That'd be fantastic.